Okay, I'm George Heckman. I'm a geriatrician, and I've been with interRAI since 2011. I first started working with Dr. Hurdes at Waterloo in about 2007 and helped with a PhD student, and eventually I was recruited. And since then, I've been part of the acute care network. I work with the integrated care network for the aged, and now I'm vice chair for the instrument and system development committee, which is the scientific committee for interRAI.
Earlier today, you told us about how you apply some of the interRAI tools in your daily practice as a geriatrician. And is that the correct term? Yeah, you use the same terminology. Just explain how you came to, select that tool and how it's used.
My first introduction was in nursing homes, and I would do consultations in nursing homes where it's mandatory to do the interRAI. And I found that when I started to use this information, I was increasing the number of consults I could see about 50%.
15 or 50?
50,
Wow,
so I could see extra patients. And so it was very useful. I found it to be reliable. And so I started using it in my clinical work. This was in nursing homes. When I see people who are home care clients in Canada, the home care instrument is also used. And so I would request that information. And eventually, when the checkup, it's been around now for a few years, it's self-report. It lends itself really nicely to primary care-based geriatrics, which is what we do. Saves us a lot of time and allows us to really focus down on what matters to the person. I've been using them myself for 14, 15 years.
Some people might argue that, yes, you were able to increase, assessments with clients by 50%, but does that also translate to quality?
Yeah, because most clients will tell you that they don't like being reassessed and that they've already answered that question with the home care person, so why are you asking? And part of the geriatric assessment is the data collection part. And if it's already done and it's useful, you have two choices. You could either see people more quickly, or you could take your 90-minute appointment time and get in greater depth with the individual about what matters to them. So you can either see more patients, or you could spend more time on the narrative. But eventually, you don't have to do as many follow-up appointments either, because you get into the nitty-gritty and the care planning in greater depth and more quickly. And so either way, it's a time saving and it's less annoying for the patient, and they really feel like you are interested in them.
And feel listened to.
Yeah.
With the checkup, that's a self-reporting tool. How do you use that in daily practice, and do you find that you still get some quality outcomes from that? Some people might argue that you'd be missing out on things because people are telling you what perhaps they want you to hear, or what they think you want to hear.
Usually they'll tell you the truth. And the caveat with using it is you want to make sure that the patient's caregiver is also involved. We make sure that happens. Self-report means that it's not assessor-driven. So self-report can be the patient, can be their caregiver, can be together. So there's certain things that lend themselves to self-report that only a patient can answer. Are you sad? Are you depressed? How's your self-rated health? Sometimes they don't have insight into their cognitive function, so having a caregiver help the assessment is important there. And generally, it's very reliable. And I trust it.
Is it widely used in Canada?
Not yet. It's fairly new, and we're using it in Kitchener-Waterloo. We have a geriatric program where we see around 400 to 500 patients a year, primary care based. In the next couple of years, Ontario is now coordinating all of their interRAI assessments into one integrated platform.
Oh, okay.
And so they will have software for the home care tool, the long-term care tool, mental health, and the checkup. So it will all be part of an assessment framework and all of these things will be available.
Oh, so that sounds like it's a holistic ecosystem
Mhm.
and truly being able to dynamically share data across
Yep.
all the paradigms of care, regardless of where the client is moving at any given point in time. Everyone can access that data
Yep.
in a meaningful way.
You'll have to be trained on how to use it, but that's
Sure.
sort of the lesser, that's not
Yeah.
too hard.
Yeah.
We can help them with that.
That's very exciting.
Mhm.
Now, before you also related a story about using the checkup tool in Africa, share some of that experience
Mhm.
with us.
So we are working with a group, it's called the PALAS Project. I can't remember what the acronym stands for. I'm not good at that, but
Okay.
essentially we started with 11 sub-Saharan countries. We're
Mhm.
now around 14 or 15,
Wow.
and they don't have the human resources that we've got.
Yeah.
But they also have a lot of pragmatic approaches to things. And our colleague Leon Geffen in South Africa had first started using it for community assessment, where
Mhm.
laypersons would essentially assess their neighbors using the instrument. And he compared the results of that approach to that of a physician-driven approach, and the data agreement was very good. And so that led us to do the PALAS project. Again, in these 11 countries, in a few months, we were able to recruit 7,000 plus patients.
Wow.
Again, the data quality is very high,
Yeah.
and the care partners that we're working with are finding this extremely useful. And now they're starting to go to the next level, is how do we plan services for
Yeah.
these folks, given our resource problems?
Yeah.
And we have lessons to learn from them.
Definitely. Oh, that's amazing. How long does it take to train a layperson how to, support someone to use the tool?
Oh, perhaps an hour.
Oh, okay. So
Yeah,
it's pretty
it's
quick.
fairly quick.
Yeah.
Yeah.
Wow, that's really impressive.
Mhm.
And there's a paper about that as well, isn't there?
There's a
Yeah.
number of papers now. Yeah.
Excellent. I'll put some links
Mhm.
in our little video about those papers. Thank you, and thank you so much for coming to visit us in Australia. We always like to have international visitors, and we've certainly learned a lot from having you here, and we
You're most
appreciate
welcome.
your support.
Thank you.
Good to meet you.
Likewise.